So welcome to our little Zoom class on acupuncture and traditional Chinese medicine. We're going to start off with a brief history for those of you who are not familiar with the roots of traditional Chinese medicine and acupuncture. It actually dates back to 6000 BC, where the first acupuncture tools were sharpened stones and bones, which they used to put in acupuncture points and also to lance any kind of abscess to help drain it. Then fast forward to 198 BC, these are when the first documented meridian systems were found. And so acupuncture has very, very deep roots, as you could see. In 100 BC, the Huangdi Jing, which translates to the Yellow Emperor's Classic of Internal Medicine, that's the earliest document found to really come up with this organized system of diagnosis and treatment, which we refer to as acupuncture. Before, in 198 BC, that was more of an overview of the meridians. Meridians are channel pathways, and we'll get into that. So it's kind of like highways on the body where energy runs through, but at that point, there was no specific indication of different acupuncture points on those meridians. So in 100 BC, that's when we really started to see that trickle in. In 1368 through 1644, there's a book called CAM that was published, and CAM is really the basis of modern medicine. It's what we use in our school, and most schools are based off of CAM. And then we're going to fast forward to 1822. And this is when, surprisingly, you would think we're picking up speed here, right? But this is actually when acupuncture and Chinese medicine really starts to decline. It was regarded as superstitious and irrational, and at this time in kind of the modern ages, or working into the modern ages, we really wanted to see more like scientific things that could be a little bit more understandable and not so whimsical, and so interest declined. In 1929, acupuncture was really kind of being upheld by rural healers and some academics, but otherwise Western medicine really started to take shape in China. And so ultimately it was outlawed, and you couldn't even practice acupuncture in 1929. Western medicine really kind of took over at that time. So then, interestingly enough, in 1949, the Communist Party brought it back into China. And so there's some debate around that. Part of it, it's said that part of it is because they wanted to preserve their nationalism, and that's kind of their roots. So even though it was once seen as superstitious and not medical, they brought it back and started to really advertise it as something, pretty great as a medical system. And so the traditional Chinese medical institutions started to integrate it into Western medical hospitals. So the Western medical hospital during that time had both Western medicine and Chinese medicine integrated within each other. This is when it starts to pick up speed, though. In 1971, there was a journalist team that went out to China as part of the advance team for President Nixon's visit. And one of those journalists had appendicitis. And after his surgery, he, instead of having pain medication, had post-operative acupuncture treatments. Those post-operative treatments helped with his pain so much that he ended up writing a post-op piece about this in the New York Times, which blew up in America and sparked interest in this foreign type of medicine. I actually linked it so you can click on the full article and read it. And so then in 1997, this is kind of the peak of when acupuncture really got credibility here in the United States. It's when the National Institute of Health gave its statement saying, yes, it works, it's effective. And I linked that statement there so you can read the full statement as well. So now in 2021, we're kind of still in this place between like 1997 and now. Have things changed? Kind of, but not really. So You know, the National Institute of Health recognizes this as effective. The World Health Organization does too. The US military not only recognizes it, but uses it on their veterans. We have protocols specifically for addiction and pain and trauma that's used on veterans and active service members in the US military. So even though we have all of this science and research, and there's a lot of people that know it works because of personal experience, there's a lot of skeptics. And I think that's with anything new or different, especially in our westernized culture. We love science. We love to say, I want to see the studies, I want to see the facts. And there's some studies out there that show it works. Actually, there's a lot of studies out there, but it's not being studied as aggressively as other things are, and that's partly due to funding. But the studies that do take place around acupuncture and traditional Chinese medicine are pretty astonishing. And one of the questions that I'm often asked is it a placebo? And we know it's not a placebo, A, because there's many studies that show it's not, but B, acupuncture is used on animals and on babies as well. And so animals and babies don't really have a concept of whether or not something's going to work. And so that's kind of your proof right there. You know, an adult, you can give them a pill or a sugar pill, and they're going to, you know, kind of talk themselves into whatever it is that they believe is going to happen. You could very easily get a placebo effect that way. But with a baby or a dog, they just exist. They don't like obsessively think about things and come up with their own notion. And so when we see things work in animals or in babies, we're kind of able to say, okay, there's something here that needs to be further looked at. So we're going to jump into traditional Chinese medicine, the meridians. So like I said before, meridians are described as an energy system throughout the body. Oftentimes it helps if we think of them as energy pathways or highway systems that run throughout the body. There are 12 main meridians, and you can see them on that little diagram there. They run bilaterally, meaning if it runs on the left side, it's going to run on the right side. We have 8 extraordinary channels, which we'll get into. It's 8 additional channels to these 12 main ones. And so we have 3 yin channels on the inside meaning here 3 yang channels on the outside of both the arms and the legs. Okay, the main channels, we can slide to that next page. The main channels are the lung meridian, spleen meridian, heart, kidney, pericardium, which we'll go over, liver, large intestine, stomach, small intestine, bladder, sanjiao, which we'll go over, and gallbladder. Most of these sound familiar to you because they're organ systems. So when we talk about, for example, a gallbladder meridian, sometimes people will say, well, I've had my gallbladder taken out, so do I have the gallbladder meridian? Yes, you still have that channel. It's not directly attached to the organ. It's a channel pathway that runs through the entire body. So in Chinese medicine, we have, like I said, the sanjiao, which is also called the triple burner, and we have the pericardium. Those may not sound familiar to you because they are not directly linked to like an anatomical structure. They're functional units in Chinese medicine. And so, for example, sanjiao is this vague system that regulates water passageway throughout the whole body. And so anytime we're dealing with water distribution, we might want to tap into the sanjiao channel, for example. Pericardium is a little bit more familiar because that's the muscle around the heart. So some of you may be familiar with that. So in Chinese medicine, we use a pattern differentiation to make a traditional Chinese medicine diagnosis. And there are so many different ways to make this diagnosis. Chinese medicine is an extraordinarily complex system. There's not one way to do anything. Everything is interconnected, everything is intertwined and goes back into each other. So in order to make a diagnosis, you could do so through many different systems, which I listed below. So you could see where it says the 8 principles method, the 5 elements, the 4 vital substances, all of those going all the way down are different ways to diagnose. There are different schools that teach different ways. I came from the 8 principles school, which is one of the most common and most popular school systems. It's known to be like the most traditional Chinese medicine. It's rooted in like the oldest history. 5 elements is the school that's in or not in Jacksonville. Where is it? It's in Gainesville. So there's a bunch of different ways that we can go about diagnosis. Oftentimes, we use a little bit of information from multiple different areas to come up with a pattern. So when I diagnose, I'll use 8 principles method on top of the 4 vital substances, the 6 stages, the 4 levels, and sometimes 3 JAWs. So it just depends on what your background and education is and how much, extra studying you do to kind of master some of these others. I will say some people spend their entire career just studying one of these, and you can literally spend a lifetime. For example, the 6 stages, you could spend a lifetime studying that. It's very, very in-depth. So with all of those meridians, we have different pairs. There's a yin organ and a yang organ, and they always correspond to each other because in Chinese medicine, everything is balanced. You can't have yin without yang. So the liver and gallbladder always pair up, as well as the heart and small intestine, the spleen and the stomach, the lung and the large intestine, the kidney and the bladder, and the pericardium and Sanjiao. Okay, so 8 principles theory. This is the theory that I tend to use the most in my practice. And so this looks at breaking things down into yin and yang, deficiency and excess, cold and heat, internal and external. So what that may look like is someone may come in with, for example, bloating, distension, poor memory, feeling really heavy and foggy, inability to lose weight, bruising easily, really tired. And so that underlining pattern would be a spleen qi deficiency. So we're looking at the type of whether it's deficient or excess. And then that's going to be an internal pattern because it didn't come from an external pathogen. And that's definitely going to be more of a cold pattern, affecting more of the yin organs. And so you can use this kind of to play off of different patterns to see where something would fall in line. It's, I think, one of the most practical ways to diagnose in traditional Chinese medicine, but like I said, I'm impartial. This is my background. Okay, moving into 6 meridian theory. So as you can see in this chart, there are the meridians that are the same color. Those are the yin and yang organ pairs, like I just mentioned in the last 2 slides. So lung and large intestine, spleen and stomach, those are always paired together. But in addition to that, we also have like a sister channel. And you could see the sister channel are connected by those lines on the outside. I don't know if everyone can see that, but hopefully you guys are following. And so this is really practical because we could predict the progression of a condition based on the connections with these other channels. For example, I'll give you a clinical example. Oftentimes I'll have parents come in and their kids will be on, say for example, they have earaches, frequent ear infections. And so they're given antibiotics for these frequent ear infections. Then all of a sudden they start getting GI symptoms. Then if they have GI symptoms for long enough that are untreated, they start getting asthma. And it's something I see all the time in my practice. It goes from ear infection, antibiotics, stomach issues, asthma, over and over and over. You can kind of predict that here because spleen, which is spleen, stomach, are always paired in Chinese medicine. Imagine antibiotics being thrown at this system. If that's not addressed properly, the thing that it's going to impact most, it's going to go up into the lungs. So you can kind of see that connection. And then it can even work itself down. So there's always pathways that are very easy to kind of recognize once you start understanding the connections. Hopefully that makes sense for everyone. This is a very brief overview. Don't lose yourself on the meridian theory. Okay, so going on to that next page, you can kind of see them broken down even more. Like I said, everything is very convoluted, but it all goes back to a baseline core. So you could see on the arm, there's a yin and a yang section. If we're looking at the yin section, it's broken down into those channels. If we're looking at the yang section, it's broken down into those other channels. So everything goes back to balance. I put on here some symptomatic references. So for example, if there's a symptom that's impacting the Tai Yang channel, you'll be able to see what symptoms are showing through for that. Okay, It's gonna pick up, I promise. This is a little academic-y, but it'll pick up. Okay, so going into the 8 extraordinary vessels on that next slide. So on top of our 12 meridians, we also have these 8 extraordinary channels that kind of lie a little bit deeper, and they house all of our reserves. So if we're exhausted, if we're chronically ill, if anything's going on where our body's kind of shutting down, our extraordinary vessels will swoop in and continue to feed us, essentially chi and energy, to make sure that we stay stable. 2 of those channels are commonly used in most acupuncturist practice. That's the Du channel and the Ren channel. And so I'll give you a little spotlight on the Ren channel, which is something that I spotlighted because it's something used in my practice so often. So the Ren channel can be used to regulate the middle jiao, which is the middle part of the body. So spleen, stomach, any kind of digestive issue. It's great for the gynecological organs, so uterus, ovaries, helps regulate menstruation. But because it runs directly down the whole body, the line of the whole body, it'll cover everything from here down. So it's going to help calm the mind, sedate the mind. It's going to help with asthma and chest pain, getting into the middle jiao, so digestive issues, going lower into menstrual issues. So it's kind of that deeper layer that helps support the other 12 meridians. Okay, on to the next page. So we kind of made it through Meridian Theory, kind of, very brief overview. And so now we got to talk about tongue and pulse. In traditional Chinese medicine, like I said, we go through our series of pattern differentiation, which is what we just got through, to really understand what's going on internally with someone. We'll ask a series of 10 questions that helps us come up with our pattern, but we confirm it with the tongue and pulse diagnosis. So when we're looking at pulse, we're trying to feel the depth and the quality, the speed of that pulse. We have 3 different pulse points per wrist: heart, liver, kidney, lung, spleen, the other kidney. So kidney yin and kidney yang. And so we're really feeling for the overall quality. When we're looking at the tongue, we're looking for color, coating, shape, density. So if you swipe the page, you'll see all these different pictures of the tongue here. These are all prime examples of what a tongue can look like and what it indicates. So oftentimes, people say, oh, I scraped my tongue, so you're probably not going to see anything. Within a few minutes, your coating will come back. So we're able to get a good diagnosis pretty easily. So depending on the color, it could be pink, it could be pale, it could be red, it could be purple. That'll give us a good idea underlying what's going on in the body. The coating is also really indicative. It could be yellow, it could be greasy, it could be white, it could be gray, it could be clear. Also, we can have teeth marks, which often indicate a spleen qi deficiency. We can have little lines going through it, little papules or little purple or black dots. So all of these tell us what's going on internally in the body. And then right under that, you'll see the pulses, like I mentioned. We're looking for the quality of the pulse. So if a pulse is slippery, if it's thready, if it's wiry. So a wiry pulse will feel like the bouncing of a ball, a dribbling of a ball. A slippery pulse will feel like skipping a rock on a river. It'll skid like that. So we can feel different pulses, and it'll help us come up with that underlying pattern differentiation. The reason why this is so important is because an acupuncturist spends 3.5 to 4 years, depending on the program, studying tongue, pulse, and pattern differentiation, studying meridian theory, studying all of these different little idiosyncrasies that allow us to come up with a treatment plan and a point prescription. So as you could tell, there's a tremendous amount of learning to really get just a baseline understanding. And I want to emphasize this because now what's happening is we're seeing a lot of other professions kind of want to get in on acupuncture. They're seeing it, be so effective. Their clients are asking for it. And so physical therapists will start doing acupuncture. Chiropractors will start doing acupuncture. Medical doctors will start doing acupuncture. The difference between an acupuncturist is we have that 4-year background and then national boards that regulate us. That's really important because acupuncture is not clearly just putting needles in the body, right? It's all of this stuff that no one talks about. Anyone could put a needle in a body. There's 400 points, you memorize the points, you stick a needle in, how hard is that, right? The hard part is the diagnosis, is understanding why are you doing that point and not a different point. Understanding the pattern differentiation behind a point prescription, and that's going to really determine whether or not a treatment's effective. Does anyone have any questions on that? I'm going to get off my soapbox. No? Okay. All right, so moving on to the next page. What does acupuncture commonly address? So acupuncture, if you go back to the very beginning of this, and I said, click on those links, it'll tell you, the NIH endorses this, it tells you what they recommend it for. There's hundreds of things that acupuncture is known to effectively address. Some of the most common I listed here. So migraines and headaches, support with autoimmune conditions or stealth pathogens, sleep disorders, mental, emotional is huge. Pain, sports injuries, pre and post-op healing, constipation, digestive disorders is another really huge one. Common colds. Most people don't even think to get acupuncture if you have a common cold, but we have acupuncture points that will help expel the pathogen so it doesn't get driven down deeper. Chronic fatigue is very, very common and something that acupuncture can help with. Menstrual disorders and PMS. So the list kind of goes on and on. For the person that's like, I'm in perfect health, acupuncture will help keep you in perfect health. It helps your body stay in balance, helps your body manage stress, and helps kind of just support an overall baseline homeostasis. And that's what we're looking for. Okay, so a typical treatment, what would that look like? So we start out with that initial consultation, which consists of your acupuncturist going through those 10 questions, asking you, things that you may think are redundant or random or arbitrary, but like I said, Chinese medicine kind of always goes back. It's very convoluted, but it always goes back to a common point. From there, they'll be able to look at your tongue, feel your pulse, and come up with their pattern differentiation, which is your diagnosis in Eastern medicine. So for example, if someone has hyperthyroidism in Western medicine, they may have one of 5 or 6 pattern differentiations. What caused the hyperthyroidism? That's the pattern that we're looking for. Was it a kidney yin deficiency? Was it a liver stagnation with, fire rising? What was it that caused that? From there, we're going to be looking at creating an individualized treatment plan for you. So depending on why you're coming, you may need a more intensive plan and you may need something a little bit more lax. It may start out with you coming in, once or twice a week for a month, or maybe you only need to come in once every 3 or 4 weeks. It really just depends on the type of condition and how long you've had that condition for. So from there, we're going to put you on the acupuncture bed, put the needles in you. They're all single-use sterile needles. You usually retain the needles for 20 to 30 minutes. So we put them in, leave you on the table for 20 to 30 minutes, and then we will take the needles out and your acupuncture session is done. Most people feel extremely relaxed with acupuncture. Most people report sleeping really well the night that they have acupuncture. It's not uncommon though for some people to feel energized after they have the treatment. So, if you're someone that's always exhausted, it might give you a little boost. It kind of balances you out. So whatever it is that you need, most people tend to get a little bit of a pick-me-up, whether it's helping them calm down or helping them kind of perk up. It's important to note that acupuncture is cumulative. So it's kind of like massage. If you have been super tight shoulders and neck and everything is stiff and you're in pain and you're stressed out and you go for a massage, you're going to feel really good. But 3 days later, you're going to feel tight again. And that's that muscle memory. So acupuncture is just like massage. You don't go once and get your treatment and you're like, oh, it didn't work because I feel no different a week later. You have to build up until you're better, completely better, and then you taper down. If you miss that building up phase, it's not going to work for you. It's not a magic pill. It's not a prescription. So you need to kind of commit to the process because you might feel great. And then, if you don't keep it up, you're just going to revert right back. So you have to kind of maintain and build up until you feel better. And then once you're better is when you drop back down. So If you can't get in for an acupuncture session, I recommend getting an acupressure mat. I did link it, you can click on it. And the acupressure mat's phenomenal because it's a mat that's got all these little prickly, like plastic pieces that stick up. It's kind of uncomfortable, but you lay on it, eventually you relax into it, and those little prickly pieces stimulate acupuncture points. Of course, it's not specific to you because it's like stimulating all of the acupuncture points, but it does help circulate qi and blood throughout the body, and that alone is phenomenal. Okay, on to the next page. So TCM, traditional Chinese medicine, as we know now, is more than just needles. It's traditional Chinese herbs. It's gua sha, which we haven't talked about, but it's another modality. It's a scraping of the body to release the exterior. It's coming up with our pattern differentiation. It's doing cupping. It's talking about food as medicine. So if you have, let's say, a spleen qi deficiency pattern, your practitioner will be able to determine what foods you should eat and what foods you absolutely need to stay away from. It's also acupuncture injection therapy. It's Meridian Theory, and it's the acupuncture itself. So, you know, as acupuncturists in the state of Florida, we're called acupuncture physicians, which I feel like is a much more realistic title because it encompasses all of this, right? But when you say acupuncturist, you kind of just think like needles in a body, something my chiro can do. So it's kind of a good idea to start thinking about acupuncture in a different way. Acupuncture is one little segment of all of traditional Chinese medicine. And when you see an acupuncturist, they're the ones that understand traditional Chinese medicine as a whole system. And that's really what you're looking for when you're trying to get treated by someone who can also do acupuncture. So, I did put it on here. So on the bottom of this page, I talk about the hours. So a traditional Chinese medicine acupuncturist, a diplomat of Oriental medicine, which is what I am, it's what Jennifer is, the other acupuncturist in our office. We all study and obtain 2,700 hours up to 3,500 hours of training within all of these different modalities, as well as undergo rigorous national board examination. Physical therapists, as little as 40 hours, chiros, 100 hours, and other medical professionals, only 300 hours. So to start contrast, and it's important to really understand why that is, and now I hope you guys do. So there's a quote that I want to end on, and this quote says, "The fact that traditional Chinese medicine has existed for thousands of years and is still used today is a testament to its value as a form of healthcare." And I personally could not agree more. It's been an honor learning traditional Chinese medicine. It is such a wisdom that I wish that I could pass on to more people. And I wish that you guys can kind of absorb. I hope you guys have some questions when you're in your sessions or talking to your acupuncturist, whoever your acupuncturist may be, because it really helps you live a better, healthier, more balanced life, which I think is really beautiful and really important. So anyway, does anyone have any questions on anything that we covered?
Yeah, how deep do the needles go?
That's a great question. So it depends. Some of them are just very, very shallow. Others go like, it really depends. So some of them can go 2 inches in. I don't really do that. We did that a lot in clinic. I usually go maybe 1/4 to 1/2 inch deep, depending on the body. Like the stomach, you're going to be able to go about 1/2 inch, no problem. Obviously, if we're doing the wrist, that's not going to happen. We'll just do very, very light insertion.
Wow, what's it feel like?
So, Jerry, look at these questions. These are great questions. I should have put these in here. So, what does it feel like? When you get acupuncture done, normal sensations of qi, and qi is the energy, life force that we're trying to tap into. Normal sensations of qi are dull, achy, numb, throbbing, electric. That goes away, so like a little jolt, or nothing at all. If it's burning, it usually means the needle went in through a hair follicle or it hit a nerve, which is very rare. You'll know if it hits a nerve, everyone will know. But usually it just means it went in through a hair follicle and you take it out and you redo it. But ultimately, it just feels a little dull, achy, numb, throbbing, not bad.
Juliann, can I, this is Jocelyn, can I address Jerry's question a little?
Yeah.
Jerry, I took my sister to get acupuncture, and she was so very skeptical, and she would not let me leave the room. I had to sit in the room with her while she got her acupuncture because she was so afraid of the needles. And they did, the acupuncturist did her entire body from like head to toe, and she's sleeping through the whole thing. And then she says, she wakes up and she goes, well, when are they going to start? And I was like, dude, your whole back, your whole body is covered in needles right now. And she didn't
Wow.
believe me. I took a picture and she's like, oh my gosh. So I've had a lot of acupuncture. I've only ever had someone hit a nerve one time. Like most of the time, I don't even feel anything going in.
Yep, that's right. Thank you for sharing that. You
Mhm.
really don't feel it.
I had a question. When you guys are studying, do you also deal with chakras and things like that? And does that line up with the meridians, or how does that work?
So we actually don't learn anything about chakras
Okay.
in our schooling. I know a little bit about it just from like my own reading, and um, so they all are in alignment with the Ren channel and the
Okay.
Du channel. But as far as that, I don't know any other similarities between
Okay.
the two systems.
Got it. How long do you have to, well, I guess it's different for every single person in terms of how long you have to do the acupuncture in order, if you have a specific problem that you're coming for, how long before you start or have resolution of a particular issue?
So that's a great question. It's very, very dependent on the type of condition. So, for example, if someone has knee pain, you should feel some relief within like 2 to 3 visits, unless, of course, it's chronic pain that's been going on for 7 years, and then it's going to take longer. If it's an ongoing issue, for example, like constipation that you've had for 5 years, then we would do 2 treatments a week for the first 2 or 3 weeks, drop it down to a treatment a week. And then as you start getting better, we'll back off. We'll do an intensive protocol like that for about 2 months or so. And depending on your practitioner, I muscle test, and that helps me come up with a plan. That's not traditional Chinese medicine. That's not classic of us. So if you're going to someone who doesn't muscle test, then we would say you'll know within the first 1 to 2 months whether or not this is working for you.
Okay.
I have a question.
Yeah.
What is I've always wondered, the acupuncture injection therapy? Like
Have we
what
not
is,
done that? So acupuncture injection therapy is injecting a substance, whether it's saline or homeopathic solution, a vitamin or an herbal, into an acupuncture point. And so in Florida is one of the few states that allows for acupuncture injection therapy. We're able to inject homeopathics. So in this office, we'll inject Tramiel, which is a homeopathic solution that alleviates pain, also helps speed up uh, like, oh my goodness, what is that word? Recovery, speed up recovery of any kind of injury, brings down inflammation as well. So if we do something like Tramiel in a knee, that's going to tremendously help that knee feel better. It's going to help it recover faster. I'll do, like, my hands sometimes get really like inflamed from all the muscle testing that I do in the office. So I'll do injections in my fingers, like in between here. And that within a minute, my pain will go away. So acupuncture injection therapy is really beneficial predominantly for pain, but also we could do like vitamin B12 injections, which currently we don't have at this office, but hopefully we'll get some soon. And we'll, instead of doing a traditional in the arm, like, your GP would, we'll inject it into, for example, stomach 36, which is a point on the leg, which is for vitality, energy, strengthening the immune system.
Okay, cool. Thank you.
You're welcome.
Can you use the Tramiel injections for like migraines?
So yes and no. I would not put Tramiel like anywhere on the face, like here, because this is such fragile tissue to do an injection in. It's very prone to bleeding.
I was thinking
However,
like occipital area.
oh, occipital, absolutely. You could do it in the occiput. Li4 is a point right here. If you take your thumb and just like, I don't know, do that, you'll land right on it. This point is a command point for migraines, for headaches. And so we may want to inject Li4 with the Traumeel. So it seems counterintuitive. If you have an occipital migraine or occipital headache, we could treat it on the hand.
Okay.
Does that hurt more than, and not that acupuncture hurts, but I guess for me it's a mental thing, but does that hurt more, and would you recommend injections over just acupuncture?
So if we're going to gauge level of discomfort, I would say acupuncture is minimal and injections are a little bit more than minimal. You know, acupuncture is the needles are super thin. It's as thin as a piece of hair. And so when you put it into an acupuncture point, it's not that uncomfortable. But when you're using an injectable needle, it's a hollow needle. So because you have to obviously inject fluid into that space. So it's definitely more uncomfortable. It's more of like it's like a blood draw needle.
Oh, okay.
And then do you
needles, not for you, maybe.
And then Juliann, for that though, do you get it done in the acu room and then you still have like the 30 minutes or 25 minutes to kind of like absorb it, or is it just kind of like a one and done?
So it could be either. Like some people that come in for knee pain, they'll just pop in for 10 minutes, we'll do their injection and they're out of here. For other people, we'll do an acupuncture treatment and then before they leave, we'll inject them.
Okay, thank you.
Yeah. So if you haven't tried Traumeel, I highly recommend it. I'm a big fan of Traumeel. I've been using it forever. I know you love it too. Yeah, it's very, very beneficial. Like I said, I inject it into my hands and it's night and day difference. You're muted. We can't hear you.
Sorry, you did it for my shoulders. They feel so much better.
Yeah, your shoulders are doing better with the Traumeel.
Much better, yeah.
Yeah, it's pretty amazing. I'm a big fan of Traumeel.
I have a question about acupuncture for treating like emotional disorders, like depression or anxiety. How does that work, I guess?
So we view mental emotional disorders in a very different light than Western medicine. So we call it Shen disturbance. The Shen is the spirit. And so there's many reasons why your Shen could be disturbed. And depending on what that reason is, we'll address that underlying pattern. So say, for example,
what about autism?
So that's a little bit different because, you know, in the text of the Huande Neijing and traditional Chinese medicine documentation, so Chinese medicine originated off of thousands of years of observation. And so that's kind of the beauty of Chinese medicine is everything occurred through observation. They were able to make adjustments. Autism was not something that was observed in the numbers that we see it today. So like I have my own opinions and my own treatment, or I don't know if I could say treatment, my own ways that I would consider addressing it. But in traditional Chinese medicine, that's not really something that's talked about.
So do you treat like the symptoms of autism presents differently for different people. So you would treat how, I guess, the emotional disturbance, I guess, that goes along with that person is, I guess that person's manifestation of autism, you know, if it's like emotional outbursts or anger or social anxiety, you would treat it from that perspective as opposed to actually treating autism.
So in theory, yes.
Okay.
We would definitely look at the manifestation and not the diagnosis, because that's always traditional Chinese medicine theory. So sometimes I'll get a phone call and they're like, have you ever treated this? And I'm always like, it doesn't really matter what your diagnosis is because it's kind of irrelevant to me, because I'm going to do my pattern differentiation and I'm going to treat your pattern. So if your pattern is XYZ, it doesn't really matter what your diagnosis is because I'll never treat a diagnosis. Does that make sense?
Yes.
Okay.
Absolutely. Okay. Thank you.
Of course. So yeah, as we've talked about in the class, there are so many different ways to address. We have the basic 12 meridians, but then that's broken down into so many ways of understanding those. And then in addition, we have all these little avenues that kind of branch out from traditional Chinese medicine. We have auricular theory, which I actually brought my book to show you guys. So this is the ear in Chinese medicine, and these are all of the different points that can be acupunctured in, or put an ear seed on to stimulate these different points. So there are over 400 points on the body, not including what's called the Ashi points, which are points that are not on a meridian. So there are so many different ways to help address an ailment or a pattern differentiation or a symptom based on meridian theory points. There's just so much that could be done to really kind of delve into some of those different areas of ailment.
You said you were recording this because you were gonna post it. Where do you post it?
So we have a blog. It's balancehealingjacksonville.com/blog, and very, very creative, right? And we'll post that on there.
Okay, perfect.
Yeah. Anything else that you guys could think of?
Not really. I just have a comment,
Yeah.
more or less, because too, just like with traditional Chinese medicine, I know we've talked a lot about, I'll put my video on. I know we've talked a lot about like acupuncture and whatnot, but I love herbs. And that's something that like I'm a longtime patient. Well, I won't say long time, maybe like 4 years, maybe of Juliann's. And a lot of times, like I'll go in for acupuncture, and then she will, like, one of the things I love so much is each time, like I kind of have the same underlying things like anxiety, GI issues or whatever, but she always addresses it however I present that day, right? And so sometimes, yeah, we'll do acupuncture, but then she's like, oh, but I think this herb would help. And like 10 out of 10 times I go home and I take it, and I'm just like, oh, it's so wonderful. And I love Chinese medicine. So yeah, the end.
Can I say what you do?
Sure.
So Ashton is a Western medical student. She's in, what year are you in?
So I'm third year. I'm about to start my clinical rotations.
So she's third year, and we always talk about how she's in school with all of these hyper indoctrinated Western medical students. And here she is in my little MD, like doing all this Chinese medicine and loving it. And so that's the beauty, is medicine really needs to be integrative, because that's when it shines. Western medicine shines when it's integrative, and Eastern medicine shines when it's integrative. So such an honor to treat you. I love treating you.
Oh, thank you. But yeah, that's what's so crazy too, is like she always says, it's like, I'll go in sometimes, I'm like, oh, I know what I have. And she's like, let's just look at the pattern. And it's like, I kind of have my things that I'll do like in my little Western way to help. And she just kind of offers something so unique and so helpful that I'm just like very thankful.
A little testimonial. Thank you, Ashton.
Yeah.
So, yeah, it's like I said before, it's an honor to share this stuff with you. I love this way of living. It helps you live and make decisions in ways that you would never consider doing so before. So like I said, with the food therapy, it helps you understand everything and bring it back to a baseline of health. Right now things are so polarized. So like nutritionists believe this and MDs believe this, and everything is so hyper polarized and so black and white. And in Chinese medicine, nothing is like that. Everything is taken into consideration. You in this moment and your current presentation, nothing else matters. And that's kind of, I think, what people need in today's day, is not this indoctrinated, like this versus that. It's more of like, well, let's just see where you are and honor the space that you're in, and then make adaptations around that. And so I hope that I can impress that upon you guys. And I hope you kind of play around with traditional Chinese medicine. And if you ever have questions down the road about herbals or about food therapy or about anything, ask your acupuncturist, because I know that they're more than happy to like talk your ear off about this, because we totally geek out on this stuff. Like,
yeah. And even same, like, I just remember too, like whenever I was first like looking for something, it literally was because I was so stressed out from school and studying. I was like, I can't sleep. My like stomach is all out of whack and whatnot. And I remember talking to like a friend, And she was like, oh, all of that stuff is expensive. It doesn't work anyways, you know, blah, blah, blah. And I was like, well, you don't know if, like, have you tried it? And she was like, no. I was like, well, I just want to try. And I remember going to Juliann, and it was like a stomach issue, and talking about food. She was like, you just need to get some okra. And I was like, okra's like, I don't know, frozen's like $2. And it was the most inexpensive thing, but it really did help to just, like, I think, coat my stomach and, like, reduce that inflammation, versus if I were to just go to, like, my general practitioner, she would just be like, oh, just take some Imodium and, like, call it a day. And again, that's not helping cure that inflammation that's causing my GI distress. Whereas Juliann, it was like, no, I didn't have to spend all this money for a prescription. Even, she literally just was like, go eat some okra, and it was effective. So that's, like, my favorite thing also to say about it. Okay.
I know we can geek out on this stuff all the time. Me and Ashton can just talk about acupuncture and Chinese medicine for hours. So
May I ask a question that's not related to acupuncture, but it's something that I saw on your website?
Sure.
You one of your resources was about castor oil packs.
Yeah.
Is that safe to do for babies?
How old?
Like really, really, we have a newborn baby that is is not using the restroom, not having bowel movements.
So before doing that, I would look into other avenues first. I will say, you know, castor oil is very gentle. For example, if a mom has mastitis or an infected or a clogged breast duct, they'll recommend putting castor oil right over that duct, which, you know, is being absorbed into the body, and the mom's still able to breastfeed. So it is relatively safe as long as the baby is not directly ingesting it. With that being said, though, I would not do that as the first line of defense.
Okay.
So I would look into other avenues like gut function. Was it a C-section baby? Does it need probiotics? Does it have an allergy to something? If it's a breastfed baby, is it having an allergy to something the mom is consuming? If it's a formula-fed baby, is there a sensitivity to something in the formula? Things like that.
Okay. Okay, thank you.
You're welcome. So anyway, I hope that y'all enjoyed the class. Thank you so much for sharing this afternoon and evening with me. I know you guys have many things that you could have been doing, and the fact that you chose to geek out with me makes me happy. So yeah, if you ever want to book an appointment, you know where we are. If you're not local to us and you need help finding an acupuncturist, I always recommend going to the NCCAOM website and finding someone who is board certified. So
how soon will this blog be up? Because I want to send someone to you, and they need to see this blog.
Oh. So well, I'm off tomorrow, so I'll probably put it up tomorrow.
Okay, perfect.
And I will send it to all of you guys the second it's up.
Okay, perfect. Thank you so much.
You're welcome. Okay, well, I'm gonna go ahead and hopefully I recorded this class.